Hi everyone, I'm Ekaterina Mariposa. I'm a doula, a childbirth educator, living here in Georgia, the country. So we all found ourselves in quite challenging times with this quarantine and the COVID-19 pandemic. So as you can see, it's all this rainy and foggy here, and it's been like that all week. And I thought I would just wait for the right weather and for the sun to come out. But I figured I'm just gonna do that video because we're so frequently just waiting for these right circumstances and hoping for everything to come as we want it to come. But life is life, and sometimes we just have to go with the flow and do what we need in the presented circumstances. And same with birth. Like in any crisis, it is so important to find our pillars that we can lean on. Something that reduces our anxiety. It looks like COVID-19 is not extremely dangerous for pregnant women and babies in comparison to other risk groups. If your hospital is allowing your birth partner in, that is extremely good news. That can be your doula, the father of the baby, your partner, your spouse, your relative, your friend, whoever that is. If they're allowed in, you have that support person, you have that other someone who is there to help. If you are to labor in a hospital in a country where partners are not allowed in, you still have your baby. The thought of you doing it together with your baby or babies can be really helpful and give this energy and strength to really feel that I'm not alone in this. We're doing it as a team. I gave birth to my son in California while being a student. I had no family, I had barely any friends while I was studying there. I found myself in a situation where I was in a foreign country in an unknown, unfamiliar medical environment, labor and birth system, so I had no idea about how it was organized in the States and in California. And I had to find all of the support I could by myself, being alone and feeling isolated. So this isolation is a pretty big word to describe all of these other experiences that you could possibly have had in your life, where you were not only put on quarantine, or not necessarily put on quarantine, but you can actually remember some of these situations where you did feel isolated, when you were really counting on yourself. So if you're feeling isolated, if you found yourself laboring in a foreign country or in a place where you were not planning to give birth, because today many hospitals are sort of, at least here in Georgia and in Russia and other countries, they are organized into categories of which hospital receives patients who are diagnosed with COVID-19 or with other symptoms of infections. So that might also not go as planned with regards to the place where you were thinking you would be giving birth. Some other plans that might go off these days is your birth team. You might not be able at this time to pick the doctor because they work only on shifts in many hospitals. So some of them are not able physically to come for your birth at the moment when you call them, be it night or day. If they're not on the shift, they simply might not be allowed to come to the hospital because of the lockdown. What else might go off? Simply anything that you have wanted to put on your birth plan, and this is a natural thing to happen. This is something that we talk about during our childbirth preparation classes a lot, even without any pandemic. I always tell my clients that you can plan every single thing and put it on your birth plan. You can think of every single detail, and you might have all that happen 100%, but you might also not. And this is also normal. This is a part of life, and this is a part of how labor and birth goes. There is something that we can actually do about it. We can actually open our minds to some other possibilities. we can remember and focus on our power and our resources that we have within us. You are still in charge of that labor. You can think about it as this outer storm that caught you off guard, but it's up to you how you can maintain that calmness, peacefulness, and decisiveness of having the birth that you want, with or without your support partner, with or without the doctor or midwife you have picked, with or without the pandemia. It's still your birth. There is a big storm, there is a lot of unknown, there is a lot of anxiety and other people's emotions and statistics and information and God knows what. So where are you in all of this? Where is your center? Georgia is one of the countries that prohibited, unfortunately, the presence of the support person at all times during labor and birth and throughout the stay in the postpartum unit. We're hoping that this restriction is not going to last long, but a certain amount of mothers have already and will still go through labor and delivery without their support people. So I decided to make that video to really encourage some of you who are going to be dealing with this in the nearest future, and hopefully some of the advice that I'm going to give based on my personal experience and work experience supporting women in labor in different countries will help you go through your labor and birth experience smoother and to the best way possible. So what is it that you can actually do to support yourself in labor and birth during the quarantine in the hospital? Make a birth plan. It can help you really figure out what you actually want for your birth, and then quickly get your staff familiar with your wishes. Make sure that it is brief, eloquent, and really conveys your particular desires from the hospital staff. 511. Go to the hospital when your contractions are roughly 5 minutes apart. They last around 1 minute, and all of that continues on for at least 1 hour. If it's a second or third birth, then you might want to go to the hospital a little bit sooner than that, when your contractions are roughly 6-7 minutes apart. Make sure that you go to the hospital immediately should your labor start with waters leaking or your water sac breaking and your waters are not transparent or not smelling nice. If they have a brown or black color or green color to them, this is a situation when you do want to be under medical supervision. Talk to your doctor that you do not want to be induced without medical necessity. If they offer you induction before your estimated due date or due time, as we like to call it, and make sure you do understand what are the medical necessities to rush your labor to start. Vaginal examinations are not recommended more often than once per 4 hours, and they're not at all recommended if your waters have already broken, because it raises the risk of getting an infection upwards your vaginal canal. No extra people in the room. This can be an important thing to remember in countries like Georgia, other Caucasian countries, and elsewhere in the world where the staff likes to fill up the room. It's accustomed to have a lot of medical professionals going in and out. You can be in control of this situation by asking any staff member whose purpose of presence you do not understand. Why are you here? Who are you? What's your name? What are you doing here? And if they are not assigned to your room or they're just here to grab something and go, you are fully entitled to ask that they are not allowed in your room. So in order to minimize cross-patient and cross-staff infection, there has to be a minimal amount of people in the room. Your doctor, your midwife, a pediatrician who's going to come in when the baby is born, and the minimal amount of nurses. Stock up with food. Make sure you have food with you when you go to the hospital. First of all, you're not going to find food in the hospital at night, unless you are in California or in Canada or in other developed countries. But in the times of pandemic, probably these are also in jeopardy, all of these cafes on the first floor of the hospital. So make sure you're stocked up on food yourselves. Make sure that the food you have packed in your birth bag has a variety, some sandwich, some fruits cut in pieces that you can put in a Ziploc bag, some juices with a straw, a refill bottle for water, a thermos with hot tea, bananas, some chocolates. Please make sure it's not only chocolate because you're gonna get sick of it. If your support person is able to be with you during your birth, he or she is gonna get hungry too, so make sure they have food. See, like that guy, he's really stocking up with food. He knows what he's doing. Dimmed lights, definitely something you're also in control of in your labor and delivery room. Make sure that the lights are off if you're laboring during the night, or the lights are dimmed, or only some kind of a corner light is on. At least you have a mask, a sleep mask, which is really convenient to have for any kind of a birth. Even if you have to have a cesarean birth, for example, staying in the intensive care unit after the surgery, having that sleeping mask can be really handful because the ICU is the unit where the lights are on all the time. So you want to take care of your own comfort here. In Georgia, the staff likes to come in without warning and turn on the light, and they're definitely not used to offering the woman to turn it off. Just it's not in the habit. If you're not gonna voice that, the light is gonna stay on all the time. The Golden Rule of Comfort in Labor by Michelle Adon: quiet, dark, and warm. These are definitely the three things that you might take care of by yourself. Ask the staff to not turn on the light without your permission. Ask them to use their flashlights on their cell phones. Every single routine procedure that they do can be done using almost no light at all. Remember that the bright artificial light really affects our labor hormones. Make sure you have some favorite music on in your earplugs or in your phone, on any device that you might want to play in your labor and delivery room. You're fully entitled to make some noise. CTG, or fetal monitoring, can be done in any comfortable position for you. If they ask you to lay down and you're not comfortable with it, you can say so, and that's okay. You can say that I want to be vertical, I want to be standing up, I want to be dancing, I want to be sitting on a fit ball. Please provide me with a fit ball if you don't see one in your room. If you are comfortable laying down, you might want to lay down on your side because this is a more comfortable position to be in and it's better for the baby. Breathe. Breathe deep. Breathe during and after each wave, each surge, or each contraction, no matter how you call it. There's no right or wrong way to breathe at birth, honestly. Worst thing can happen is that you just stop breathing completely. And this is what messes things up, because when your muscles tense up and you don't breathe into them, your pain sensations rises up. If you do breathe, then your muscles get filled up with oxygen and your pain sensations go down. Keep hydrated. Use your refill bottle. Ask the staff to bring you some more water. And I know it's kind of hard to remember that when you're in labor, but just keep that bottle next to you all the time. And that's why refill and sport bottles are good for that, because you can kind of close them. You don't worry about them spilling like you would with a simple plastic cup. So that's also one of the ways you can take care of yourself. Keep that bottle by your side. Pack your belongings in 2 separate bags, which will make it much more convenient for the staff to sanitize them as you arrive. Pack your labor and birth belongings separately from your postpartum belongings that you might need in the postpartum unit for yourself and for your baby. Make sure that these bags that you use are hermetic and the sanitization won't damage your belongings. If you're arriving at the hospital in active labor and you don't want to be dealing with washing your hands in every single unit that you pass through, just put on gloves. These rubber gloves before you leave the house. Wear them in the taxi or in the car, and when you arrive to your labor and delivery room, after passing through all of the filters in the hospital, just take them off and throw them out. Since April 17 here in Georgia, a new follow-up restriction has been put into place. All women in labor are now considered to potentially have COVID-19, and because of that, they're supposed to wear facial masks during labor and birth, as well as the staff. I honestly, as a doula, have no clue of how this is going to be presented because I don't understand how a laboring woman is supposed to wear a mask, so we're going to see about how that goes. But if you're not facing that kind of restriction, you still want to wear a mask if you are moving between units, because this is just for your personal safety and protection. The reason why the staff is requiring that is because they are trying to protect themselves, which is a very understandable standpoint, and we want to support that as much as we can, but also, you're in labor and you need to be able to breathe. So be ready to talk about that with your staff. Make sure that you push in a comfortable position that you have chosen. This is an extremely important thing to highlight in the post-Soviet countries, where there's still a very strong habit from the staff to place the laboring woman on the pushing stage onto the cushion and on her back. Myself and my colleagues all over the post-Soviet space are really working hard to educate women that this is not a comfortable position to labor and to push, and that you are fully entitled to pick a position, any upright position, sitting up, being on your fours, leaning on the bed, sitting on a birthing stool if they have them, or on some kind of a very low chair. That could do that for you if you want to be more vertical. Picking a comfortable position for pushing is the best preventative technique to avoid episiotomies, vacuum extraction, and instrumental forceps delivery, or something that is called a Christeller maneuver, which is a pressing on the mother's abdomen, like right here, which is a prohibited maneuver all over the world. Don't ever allow anybody to press on your belly to squeeze the baby out. This increases risks of traumatization of the neck of the baby and traumatizing your perineum significantly, and you're not a tube with toothpaste to squeeze anything out of you. So picking the comfortable posture for pushing is crucial. Also, you might want to ask the midwife not to count from 1 to 10, asking you to hold your breath. Push as you feel like pushing. Remember that your baby is going through a rough spot right now at this very moment. He or she is supposed to go through a very narrow area in your body, and they need time. There's no need to rush them unless they're feeling distressed and the staff is worried for the baby to be born quicker. Routine rushing of the baby to come out is not okay. Delayed cord clamping is something that is practiced almost everywhere in all of the hospitals these days, but sometimes when the staff is in the rush, they might do it a little quicker. So you can also remind the staff that you want the delayed cord clamping. If you are into a lotus birth, which means that you want the cord to be clamped after the placenta has been born, you may also do that. Just make sure you tell that a little bit ahead of time. When the baby's born, this is a magical moment that can be very intense in emotions, and a lot of things are happening during this moment, and the staff is usually more active. You only have to remember is that you're fully entitled to ask of the pediatrician to check the baby while he or she is on your chest, on on you. The baby needs this microbiome of the mom. There's absolutely no need to put on a diaper immediately. There's no need to measure the weight and height of the baby right away. The only thing that the baby needs is you. All of the routine examinations can be done in an hour or two afterwards. In the postpartum unit, it's a whole different universe. The staff doesn't know you. They're not familiar with your birth plan or with your wishes as of how to treat you or your baby. And in countries like Georgia and other post-Soviet countries where women are not as used to voicing their needs and the staff is not used to birth plans or some individual requests from women, you're likely to have just a routine care for you, just like everybody else, which is not bad on its own. It just means that if you want it to be different, you need to talk about it. If you're exclusively breastfeeding, make sure they know. For example, in Georgia, breastfeeding is not very well supported, and formula is likely to be given to many babies without indication for it. So make sure you tell every single staff person who comes into your room in the postpartum unit that your baby is not to be fed with formula or sweet water in any case scenario unless the pediatrician assigns so based on the numbers of weight loss that the baby is having throughout the first 2 days in the hospital and based on their blood tests. These are the only circumstances in which the doctor makes a decision that the baby needs formula. All other situations are related usually, unfortunately, to the staff's unwillingness to help out with breastfeeding. So be proactive, ask for help, ask for them to send you a specialist who is knowledgeable in breastfeeding in the first 3 days because it has its own specifics. Ask for them to spend some more time with you to explain and answer all of your questions. If you still have some questions about breastfeeding and it's not working smoothly for you right now, so many lactation consultants have gone online and are adjusting to helping online, including myself. So feel free to contact anybody who you will find on internet, who you know through Facebook support groups. Make sure you don't stay with that alone, because breastfeeding is the best thing you can do for your baby, and if you are intending to breastfeed, you will do that. So this is it, guys. I hope that was useful. I did my best to accumulate some of my knowledge and my experience and give you some advice on how to support yourself if you're laboring during these challenging times in the quarantine. In addition to that, if you're laboring in a foreign country where you were not planning to deliver your baby, but here we are. We have ourselves, and you have yourselves, and you're gonna do it. And I wish from the bottom of my heart for you to have the very best labor and birth experience that you can possibly have. Let me know if you liked that video, if it was any useful for you, and what other maybe subjects that you would like me to cover. And if you have any questions, I'd be happy to answer them. Bye for now.